edition of the MDAs update. This is where we bring you heads of ministries, government agencies, and government departments. They will come under our spotlight and explain to us how they are contributing to the solution agenda, how they are ensuring that the dividends of this government gets to you, gets to me. My name is Oluchi Carlo Emeka. Remember, you can still call me Luchi K any day. The MDA's update ebe na ewetara gị soludo n'ihe ndị dịgasị mma ọ na-eme na oruturu gị na oruturu m. Taa ebe anyị ga na-ene anya bụ na ahụike. Yes, our focus will be on the Ministry of Health today. Onye anyị na-anọ bụkwa na onye isi ahụike, ihe gbasara ahụike na Anambra State. He's Mr. Commissioner for Health. His name is Dr. Afam Obidike. Doc. It's no one can again. Can tell you Doc. You're welcome to the MDA's update.
Yeah, the Bible. No,
Ima ndị Bible ndị na-asụ Igbo na-asụ Oyibo enwe ndị gụọ ọnụ nwe ndị na-agụsịrị nwe ndị na-azụ afịa nwekwana ndị fili na ike Oyibo adịrọ m, so because of that I sụtụ Oyibo I asụtụ Igbo. Before we start properly, so I will not move outside your mandate, I would like you to explain to us kọwara anyị kedu ife ndị ministry gị na-afụ maka ya, kedu ihe a sị nọ ihe a ka ndị Ministry of Health na-afụ maka ya.
As you know, Ministry of Health in Kibo, na Ahụike, Ministry of Ahụike na the state, meaning that everything pertaining about the healthcare system in the state is within the Ministry of Health, be it provision of health services, be it prevention of disease occurrence, be it lifestyle modification, be it able to improve all the activities in the health insurance, primary health care, and all that. So that's all under the Anambra State Ministry of Health.
All right, so basically this government is roughly a year plus.
Yes.
And during the 1 year anniversary, a lot of achievements were listed, which your ministry, some of the achievements were also attributed to your ministry. So I would like to know, under your government, can be bata Boronyisi Iebasara Arike? Keda achievement in Mexico?
Yeah, thank you so much. As you know, we are a year and roughly 6 months in government now. So, and we have started immediately with the Mr. Governor, looking into the agenda and manifesto of Mr. Governor on healthcare system in the state, because the Baimana are able to maintain in everything. And the health is wealth. So everything we have been able to do in the Ministry of Health is tending towards ensuring the manifesto and the agenda of Mr. Governor is well achieved. First, obviously, everybody, everywhere, so you do gap analysis. So in order to ensure that the gap you are going to fill in is there. So when we came in, we did that, and in every system of building the healthcare system, in all of them, be it human resources for health, be it infrastructure, be it in service delivery, medical equipment supply, and health information, we look into each and every one of those things. And first, if we start on the area of the area of the human resources for health, we did a gap analysis on that. We found that almost 19 of our hospitals, general hospitals in particular, are now with medical doctors and other healthcare personnel. So that is when Mr. Governor then approved for employment of almost 300 medical personnel, healthcare personnel, to fill in those gaps urgently, where we have the consultants, almost 10 consultants were employed. We have 46 medical officers, 138 nurses, nurses, pharmacists, and the medical lab scientists, and the radiographers. They were employed, and this actually helped to improve the services. In fact, just recently, last week, in further to fill in the gap exists, the governor actually also approved the recruitment of 500 healthcare workers. In the 500, the recruitment is still ongoing in the majority to work in the primary healthcare, and also to help us in the telemedicine that we started that we want to, the governor want to expand in the whole institution. Then area of infrastructure too, we look at it, found that there is a need for improvement in the infrastructure activity in healthcare, some of major regional hospitals then, and we commence urgently renovation of 3 general hospitals, 1 per senatorial district, where we have Umueri, Kulobi, and Enugu General Hospital. And that has actually helped to improve the services that are rendered there, because when we have improved the human resources for health, you improve the infrastructure a bit. You see, people now have confidence in going to seek for healthcare services there. And truthfully, especially in the area of pediatrics and all that, that we have seen a tremendous improvement in that regard, because you see now people, the pregnant women could go there and get their distance. Then when we look at also then, when we started, I forgot to mention that one of the first things we did was we were able to share 3.8 million mosquito nets to almost all the households in Anambra State. And that has drastically reduced the incidence of fever that is attributed to malaria from almost 98 when we come on board to almost 87 to less than that. So you found that that has actually helped to improve the outcome of services there. Then there is this thing when we did our gap analysis. One of the major gaps we detected is the people where they do go for these eye care services. Okay. And we were able to establish an Anambra State Eye Care Center at Nise, and we're furnished and equipped that people do go there and get a lot of services. And that services has actually, you see, blindness. You know what is when you don't have access to the number of people that access the service over there. Then we'll talk about the oxygen plant we established at General Hospital Onitsha. And also mammography machine we established there, and endoscopy machine, endoscopy unit we established at General Hospital Onitsha, that have improved the quality of services that we render to the people there. We also started this telemedicine. We launched the pilot study then almost a year ago at Okozo. That served as our hub then, our pilot there. But now, just last week, the governor approved for it to be extended to all the whole state. What it means is this: human resources for health will continue to be a problem in Africa, in Nigeria, because people will continue to migrate no matter what you do. We have tried to improve the salary and all that. But the next thing is this: we now have to get a technology where you can be here and a nurse at Enugu to a hard-to-reach area. We need the services of a doctor. Just through telecommunication, through internet telemedicine, you'll be able to do services. And that's, when we piloted it, we have almost 1,000 of people that got their services through that side. And that services is that some of them could have been a very major issue if they don't have access to that. So with that pilot study, the governor approved for it to be expanded throughout the whole state. And very shortly, we are going to see it expanded in the whole state. So I mentioned Okozo. I was coming here now. I got a call because we have these services we are rendering to the whole state. Somebody called that I should thank the governor about the wife went to the river at one of the hospitals at Okozo, and they didn't charge them any money. So that's one of the services the governor just launched beginning of this month on having the free antenatal services and free delivery for all the citizens of Anambra State. And
all right. Thank you so much. Like I said, it's been quite a huge one. Say, all these achievements you listed, maka ndị mmadụ ka ga-akpa anyị jụọ ma anyị na-asụkwa Igbo. Ihe a niile ịkọwa kịta unu rugasigo na ofu arọ.
Yeah. There are still many. There is not. I have not done.
Oh wow!
There's
Please.
still huge.
All right.
So,
go on.
Less people communicate.
Oh, okay. Okay. So please, if you're listening to us via the radio, We're going to be calling out the phone lines that you can call. But if you're watching us via our TV or our online platforms, the numbers are right there on your screen. For those listening to us via radio, please call us. Anyị na-ayọ unu ka unu kpọọ anyị. Anyị na onye isi Commissioner na-afụ maka ahụike Anambra State. Anyị na-anọ na studio. Nwa ajụjụ inwe gbasara ministry na-afụ maka ahụike Anambra State. Anyị na onye isi fanọ ka ịkpọ anyị. Akara ekwentị ị ga-eji wee kpọọ anyị ọ bụrụ na ị na-ekiri anyị n'ihe onyonyo ọ dị na screen gị, ọ bụkwa na ị na-ekiri anyị na Facebook gị ma YouTube ọ dịkwa na screen gị, mana maka ndị na-ege anyị ntị na redio aga m akpọpụta ya ka anyị nụ 0811 905 5555 0811 905 5555 maọbụ 0701 863-9546 0701-863-9546 more 0902-327-3484. Hello. Hello. Oh, okay. Ka mkpọkwa nke ikpeazụ ahụ ọzọ 0902-327-3484. Hello? Hello? Amaghị m netwọk ma n'ịkpọ anyị ịkabarụ ka ịjụ anyị ajụjụ na anyị na ebe a. Ka m na-eche ka fakpọ onye isi ikwu maka na-ada na ndị dị ime na ndị na-akwado ịmụ nwa. Okay, we have a caller. Hello?
Hello?
Aha, good afternoon. It is Heartbeat of the East.
Yes, wonderful. But please, I want to commend the Minister of Health.
Please,
the governor for the free and attack care. I thought it was a scam. I thought it was just mere rhetoric. But it is.
Please, what's your name and where you're calling us from?
From Okuzo. Yes, and Akayos.
Pius.
Yes.
Okay.
My wife went for antenatal care. The nurse told him at Omudoka, the Binago, from my health care center. The nurse told her everything is free. But the way the nurse was not, it showed that the government was really serious about everything. But the nurse was not announcing to them everything is free. So they gave her this pregnancy care total life.
Okay.
But I mean, hello.
Hello, I know if you know. I know
and how much that dog is working in the pharmacy. So it's really, I want to thank the government. I want to thank the Ministry of Health. I want to thank Solution Governor. But my wife's name is Zaya Chidema. It's really, she came back and was jumping up and down. She was amazed that the whole is being handled. So please send my greetings to all this around there. So we are so glad the governor is keeping to his words.
Thank you very much. Thank you very much. Okay, so I really wanted to ask you to speak more on that. Man, obviously, they can never mind the reap or got the fruit already.
We have had almost more than 50 deliveries on this.
Wow.
And none of them paid money. And one of the things is this, because before we say this, we didn't just say we start this. We have actually trained almost 350 of our healthcare workers on what we call modified life-saving skills, which will improve their quality in the life. Because in the manifesto of the governor, we don't only speak of employment, we talk about employing and training, because we believe that people that are working in the healthcare system, you need to have updating their knowledge and skills. So we have actually done that to ensure that the quality of services that are going to be rendering to our people is top notch. In fact, a year exactly, or 6 months ago, we actually trained them on what we call helping the baby breathe. That's a training that we carried out. Almost 500 or more of them benefited in conjunction with UNICEF to train our nurses choose on what we call helping the baby breathe, how baby could actually be resuscitated when alive. And we have been making progress to train them on what we call basic life support. And I'm sure very soon we'll come to this ABS and also train some of their staff.
Please, that would be nice.
Because our target is that every citizen of Anambra State at least should be able to know how to perform this.
Oh wow, that's very nice. So this particular free medical treatment for pregnant and delivery free
antenatal
antenatal and free
services and
delivery.
free delivery for
Where
people
exactly
residing in Anambra State.
is
We
it?
have it in,
All hospital or
yeah,
just all government
yeah,
hospitals?
thank you so much. We have it, it's done in all the three, we have 326 wards in Anambra State, and all the 326 wards have one primary health care there we have designated for this function.
Oh, okay.
Then all the general hospitals in the state
Okay.
are also places you can get these services. And the good news is that when you go there, like the number, one of the person I called today, the number is there. If you are not satisfied with these services, if you are asked to pay money, there's number is there. My number, the number of the agencies and the other people, and the number of the head of administration of the hospital are there to be called and make a complaint, and it will be taken care of immediately and efficiently. You know, there is, also we are talking about women. We quickly want to talk about this cervical cancer screening we are doing. You know, the wife of the governor actually started it a year ago, free cervical cancer screening. And the good news is that today alone, we have been able to train almost 7,800. We have been able to screen 7,800 and something women. And percentage of them, because this is people that are found positive at early stage, we offer them a treatment for that. And we have gradually done that. We are doing it in conjunction with UNICEF, WHO, and CHI. So, and this has also service. I'm using this medium to also call on people to also go and have themselves screen to that, because it's good to do that. We are working hard to ensure that this human papillomavirus vaccine will soon be in the state before ending of this year. Yeah.
Okay, so I would like to ask you about vaccinations. Vaccination. Anum na abo ebido vaccination like OPV, polio, and even the cervical cancer you spoke about. Abo abia na agwande mmadụ maka achọrọ ka ịkọwara anyị your achievements in that area, your plans in that area so far. How is it?
Yeah, thank you so much. That comes to very essential, because you know when I told you they achieve the healthcare system, you have the promotion, protection. This is one of vaccination is protection. When we assume office.
Sorry, let's take this call and you go back to that. Hello. Hello. Please continue.
All right, thank you. So when we assume office, we're having issues with measles outbreak in the state.
Okay.
And what we did was, with the WHO, we look at the data and found that probably because of the previous COVID-19 lockdown under some 9 communities in Anambra State, we are not actually vaccinated. Local governments, we are not actually vaccinated appropriately. Their rate of vaccination was a bit less than 70% of expected to be vaccinated. So you see there was outbreak of measles there. So that early stage in the government made us to modify our vaccine activities and others. So we did mop up in those areas, having a fixed vaccination point, mobilizing to go and vaccinate the children there. So what we have done in those areas, you can see that we have activated our vaccination activities, both Jengos and all that, and even the churches. Then there's one that we started, the wife of governor started, and we want to commend on rotavirus vaccine. Okay. Initially, this vaccine takes people 6,000, 7,000 before we came on board. And it's vaccine that makes children, at least help them to reduce the rate of diarrhea and all that. But we have been able to activate it, and it's free in the state. Okay. And the rate of is, in fact, and initially when it was supplied by UNICEF and people we are still collecting on, but we thank the wife of the governor through her continuous support, we're able to ensure that at least everybody in Anambra State now have access to this vaccine. Currently, we are doing outbreak response on polio and all that, and I'm sure everybody in the market and in the street, you see our team going on with UNICEF and WHO.
Sorry, we have a caller. Hello.
Hello, good afternoon.
Good afternoon. Kedah Fagin Ebisa. Welcome for you, heartbeats.
Yes,
Go on. Okay, Chinwe Ganiru.
cancer screening now. So I got test screening.
No, it's still ongoing. Yeah, madam. Hello, madam.
I'm with you.
She has extended it. My madam extended it. Yes, okay, yeah, thank you. She has extended it, and you can go and have yourself screened. And
People were asking me to call, so that's why I said.
no, yeah, Waziahana, it has been extended, and we have done that. The first one, we screened almost 8,000 persons, and we continue to do that.
Okay,
So,
don't be annoyed. How long? What is deadline, please?
on one of the deadline now, just ensure you tell people to.
My dad told her, from no record. God bless you.
I'm at your boy,
Oh, thank you. Welcome for her indeed. Okay. I want to pose also again. I know
no, she's doing so well for the women of the state.
Yes.
But I didn't even speak about the healthy living with Nadia Soludo that she's championing in the state. We have been to, she's extending the program. We're talking about the healthy lifestyle of our people because you are the product of what you eat.
Yes.
So we have the healthy living. That is another talk for another day that she's championing that has actually helped to modify our people in terms of nutrition, in terms of their mental health, in terms of the basic life support, in terms of even the exercise, because exercise is a very good thing that she's proposing for us, even in terms of the reproductive health. So she's actually at the emergency service care. So this program she has extended to the youth now. We're having youth engagement almost every week. We go to each of the local governments.
Oh, okay.
We have active youth engagement on that.
I'd like you to tell me, I've been hearing a lot about telemedicine. I would like you to talk to us about this thing called telemedicine and how it's going to help improve healthcare in Anambra State.
Yeah, thank you so much.
Mama, thank you.
Because all your benefits in the buy. Now you never telemedicine, yeah, I'm not begging. What you on ABS ever? It's an hour for instance. It's a KJ go tongo. It's a digital and chemist go tongo. Hey, you see, it's a cable go to doctor.
Malaria.
A more doctor now, I carry that's phone, right? On saying where you make it, as in you consult a doctor, that's what we'll put it.
Via phone?
Yes, via phone.
Wow.
Yeah, we are doing it, and I'm the first to start it. We started the pilot at Nobi, at Okozo. If you go there, you see it. Then doctor will see you and tell you, okay, this, that. You go to this, all go. Then, or you go to a primary healthcare system. We have like 326 primary healthcare. We have more than that, but we are focusing on one per ward. That's what the government wants to do. At least one, to be very functional. So anywhere on your on Anambra State, you have access to a medical doctor. So you go to a primary healthcare dinner. Which village are you from? If you are
stay in Amobia, for instance. There's one at Red Cross.
That one is yeah, in Red Cross, for instance. We now say, okay, that you went there to see a doctor. The chew there or the healthcare personnel. Or check his so he has a means to call a doctor in our hub.
Oh wow.
That primary healthcare become a spoke. So when you call a doctor there, the doctor will see and advise and tell you what to do, and the nurse there will do it. You get a care treatment.
Oh, okay, so let me cannot say all the corner na get a bank issue. More issue with line again. A customer care center for wagi he game. Ihe na akọwa bụ na no the kita man no na be mo bụ na isi na awam kama masị na malaria je go malaria na mma kpọnwụ doctor.
Correct. In anywhere you are in Anambra State. Even we did it in such a way that ndị nọ na Enugu today, the founders of Anambra State. Just a chew there or healthcare personnel there can link up to a doctor, because with this recruitment we are doing now, we have 2 doctors per local government that their work is to answer and diagnose and treat people.
Wow.
Via telemedicine. We have piloted the study and we treated almost 1,000 cases. And most of them, you see the feedback of people we treated. Fantastic. Then the ones that we know that this will need more treatment, you ask them, go to the nearby general hospital, get this doctor consulted you, and you see it. Then the next place we are going to do is that some of those general hospitals and tertiary institutions, you link it up to outside the country. We are going to build that one.
Wow. We'll come back to that. Hello? We'll definitely come back to that. It's quite interesting.
Yeah, St. Joseph Hospital to Adaze Nuke, right? Yeah, they have a doctor there now, so you go and consult a medical doctor there. But what we say is this: in a places that you don't have access to get a doctor, you yourself you can actually call a doctor close to a place that instead of you going to be treated by quacks and all that, you get across and be consulted by a doctor and be treated.
Please, our government doctors also.
Very qualified government doctors, qualified, ID certificate. I distribute. Yeah, each of the local governments, we have the numbers and all that. So everybody, because we don't want people to be at risk and be getting something that is not good. So that's in fact, the partner we developed this in actually came down from United States of America. They spent some days, yeah.
Thank you very much.
Thank you.
Okay, go on. About the number, is it that different local governments with different phone numbers?
Yeah.
How will these phone numbers be accessible to the people?
Yeah, it's very accessible, and we just approved it last week Friday.
Oh, okay, so it's still very fresh.
No, the one of Okozi is everywhere, but the one that we are piloting, but the one we are going to use for every local government, because we don't want a situation whereby you can be calling number based, so we are decentralizing it to each of the local government. Well, there is one number, unified number we have in the state that people don't know, that if you have emergency or accident, we started it, the governor, we started Anambra State Emergency Medical Service and Ambulance System. Yeah, what it means that you can call 112 here, you can try the number, 112, and request for ambulance services. And ambulance will come. No, not link you. Ambulance will come and take you to the hospital in cases of emergencies. This was piloted in Abuja, and Anambra State was the first state that started it outside Abuja. So you can call 112 and you get your services on the ambulance services.
All right, let me take this last call. Hello? Good afternoon, Boy and Kenke. Wagam champions. Boy and Kenke.
You go when I do my hospital and Enugu.
Yeah, on Enugu General Hospital. Just go there. Enugu General Hospital is one of the hospitals we train the doctors on their cervical cancer. So go there. Yes, go there and so it does.
Thank you.
So just go there and encourage other women.
Thank you. Because of time, I had to
come.
Please, myself. I'm not done with you. Sorry. Mr. Commissioner, I don't think I'm done with you, and it's obvious that we don't really have time. So I'd like to, on air, although I know you might not like it, but I'd like to on air invite you next week, because I still have a lot of questions. I'm I'd like to know whether your ministry when Kunu say check on your nurses and your doctors, because I won't lie, sometimes. Okay.
In the hospital, it's not only employing people. No.
Okay.
If you go to our hospitals now, there's a banner there. If you are not satisfied with services, call this number in our general hospital. Then we have, the governor has approved, we have not approved, we have done what we call clock in.
Oh, okay.
Meaning that when you're supposed to come to work, you must clock in at that time.
Okay.
And if the time you're supposed to come to work, you don't come to work, it's showing, because immediately you clock in, I will show you my phone, I'll show you the clock in schedule, when each and every nurses and the choose and everybody clock in. Especially in our general hospital, that's what we said, and at Amako. We have installed it at Amako. Oh, wow. So we have already thought through on that, because it's not only having a human resources there, you must have a way of monitoring them. So that is one of the ways we have actually checkmate this, and we pay them. When you come late and you don't do that, we are not going to pay you for the ones you didn't come.
Oh, wow. We're still definitely going to talk about it next week. I really hope next week you'll have time to include us in your busy schedule. So, in the Bible, no nega into no biko bagalo na any oge no zi kwarapo. Imani de kwan na time na broadcasting, but no. Over time, onye ọzọ nọ n'azụ echege ya bụ na ihe ga-emanya yogo commission ọ ga-abịa next week. Ihe anyị ka ga-ekwu maka Erika, ọ bụ na onwe ajụjụ inwe over the week detuo ya na commissioner ga-abịa next week, anyị na-anọkwa ka anyị jụtọpụ na mụnwa ajụjụ nwekwa Erika ajụchara m nke gị nwakwu amakwa m na network ekwero. So we want to thank you, Mr. Commissioner for Health, Dr. Afam Obidike, for coming, carving out this time out of your busy schedule. Please.
No, it's my responsibility. No, we are employed to serve the people of the state. So, and we are accountable to the people. So, we definitely, any means, like my number, uh, all those everywhere, people call for complaint and all that. And we are almost excited, but we also want to ask the people to continue to support our governor, Professor Charles Chukwuma Soludo. Only a very wide ambition, and there's a good intention for the state. You see what he's doing in every other places, construction of roads and everywhere. And please, we want to ask on the people of the state to continue to support us.
All right, so if we come next week, we'll also talk about how you too can support the Ministry of Health to ensure that their work gets easy. And I actually pray that every medical doctor out there and every government worker, including my very self, Lichike, will have that mindset of Mr. Commissioner, the mindset that we are serving. All right, till next week when we come your way again, same time, same station, same platform. However you're watching us or listening to us, it's going to be me again, Oluchi Kalu Emeka, and I'm going to be sitting with the Mr. Commissioner for Health. We'll conclude this conversation. Please see you next week. Bye.